7 fatal causes of heart failure. Most people ignore. Heart failure usually happens slowly and happens when the heart muscle can't pump blood properly, and this can cause many symptoms and complications. There are many causes of heart failure. They can come from genes or lifestyle choices. In this video, we will highlight 7 fatal causes of heart failure most people ignore. Knowing these factors is the first step to keeping your heart healthy. But before we dig in, can you do us a favor? Help us spread this life-saving message by hitting the thumbs up. And if you're new here, don't forget to subscribe to Combat Heart Disease and click the bell icon so you never miss out on our new videos. And stick around to find out how to get 2 heart health free gifts. We guarantee both you and your heart will love them. Let's get started. Number 7, high blood pressure. High blood pressure, or hypertension, is often referred to as the silent killer because it typically has no obvious symptoms, yet it can cause devastating damage to your heart. When your blood pressure is consistently too high, it forces your heart to work harder to pump blood through your body. Over time, this increased workload can lead to the thickening of the heart muscle, eventually weakening it and making it less efficient at pumping blood, a condition that can culminate in heart failure. According to a study published in the Journal of the American College of Cardiology, individuals with uncontrolled hypertension are at a significantly higher risk of heart failure. The study found that high blood pressure is responsible for approximately 50% of heart failure cases globally. Hypertension is also closely linked to other severe health issues, including stroke, kidney disease, and cognitive decline as we age. Additionally, it can contribute to the formation of aneurysms, dangerous bulges in blood vessels that can rupture, leading to life-threatening complications. A diet high in sodium is a significant contributor to elevated blood pressure. The Centers for Disease Control and Prevention states that reducing sodium intake by just 1,000 milligrams per day can significantly lower blood pressure and decrease the risk of heart disease and stroke. Alongside dietary changes, regular physical activity and maintaining a healthy weight are vital in keeping blood pressure under control. Moreover, limiting alcohol consumption and avoiding smoking are essential steps in reducing hypertension. Next up is another condition that directly affects your heart's blood supply. Number 6, coronary artery disease. Coronary artery disease is a common heart condition and a major contributor to heart failure. This disease occurs when plaque, a combination of fat, cholesterol, calcium, and other substances builds up in the coronary arteries. These arteries are responsible for supplying oxygen-rich blood to the heart muscle. As more plaque accumulates, it causes the arteries to narrow, a condition known as atherosclerosis. This narrowing restricts blood flow to the heart muscle, leading to reduced oxygen delivery. When blood flow is decreased, you might experience symptoms such as chest pain, shortness of breath, or, in severe cases, a heart attack. During a heart attack, the blood supply to a part of the heart muscle is cut off completely. This lack of oxygen can cause irreversible damage to the heart tissue, resulting in scar formation. Scarred heart tissue does not function as well as healthy tissue, making it difficult for the heart to pump blood effectively, thereby increasing the risk of heart failure. But there is another underlying condition that quietly contributes to both coronary artery disease and heart failure. Number 5, obesity. Obesity is more than just carrying excess weight, it's a major risk factor for heart failure. When you have excess body fat, your heart has to work overtime to pump blood throughout your body. This increased workload can cause the heart muscle to thicken, a condition known as hypertrophy. Over time, this can lead to the heart becoming less efficient at pumping blood, eventually resulting in heart failure. Obesity is also closely associated with other conditions that further elevate the risk of heart failure, such as high blood pressure and dyslipidemia, which is an imbalance of cholesterol levels in the blood. In fact, a comprehensive study published in The Lancet found that individuals with obesity have a 50% higher risk of developing heart failure compared to those with a healthy weight. One of the mechanisms linking obesity to heart failure is the accumulation of visceral fat, the fat stored around your internal organs. This type of fat is particularly harmful because it triggers inflammation and insulin resistance, which can damage the heart and blood vessels over time. Managing obesity through a balanced diet, regular exercise, and in some cases, medical interventions is crucial in reducing the risk of heart failure. Even modest weight loss can significantly lower the strain on your heart and improve overall cardiovascular health. However, there's another common issue, often overlooked, that can also contribute to heart failure if left untreated. Number 4, sleep apnea. Sleep apnea is a common disorder where breathing repeatedly stops during sleep, significantly impacting heart health. There are two main types: obstructive sleep apnea, caused by throat muscles relaxing too much, and central sleep apnea, where the brain doesn't send proper signals to control breathing. Untreated sleep apnea leads to frequent drops in blood oxygen levels, putting stress on the heart. Each time breathing resumes, blood pressure and heart rate spike, which over time can weaken the heart muscle and increase the risk of heart failure. Additionally, sleep apnea is linked to high blood pressure, resistant hypertension, and heart rhythm issues like atrial fibrillation, all of which heighten the risk of heart failure. Sleep apnea is also associated with metabolic conditions like insulin resistance and type 2 diabetes, further raising the risk of heart disease. If you suspect you have sleep apnea, it's important to seek medical advice. Treatments like continuous positive airway pressure therapy and lifestyle changes can help manage the condition and protect your heart. Early signs of heart failure can be both subtle and easy to ignore. They may look like normal signs of aging or other simple health problems. However, it is very important to notice these early signs to catch heart failure early. One of the first signs is shortness of breath. This often happens when you are physically active or lying flat. The heart may find it hard to pump blood well, leading to fluid buildup in the lungs. You might also have a consistent cough or wheezing, especially at night. Other signs to watch for include feeling very tired and weak, swelling in your legs, ankles, and feet from fluid, and a fast or irregular heartbeat. If you see any of these symptoms, you should see your doctor for a complete checkup. Number 3, alcohol and drug abuse. The harmful effects of alcohol and drug abuse extend far beyond temporary intoxication, causing serious long-term damage to the heart. Chronic use of alcohol can lead to alcoholic cardiomyopathy, where the heart muscle weakens and enlarges, reducing its ability to pump blood effectively and raising the risk of heart failure. Alcohol abuse can also cause arrhythmias, like atrial fibrillation, which further disrupt heart function. Drugs like cocaine, amphetamines, and certain prescription medications can severely damage the heart. Cocaine can cause sudden spikes in heart rate and blood pressure, leading to heart attacks and coronary artery spasms. Amphetamines can lead to structural heart changes, such as thickening of the heart muscle, increasing the risk of heart failure. Opioid misuse can result in dangerously slow heart rates and low blood pressure, impairing heart function. The combination of alcohol and drug abuse is especially dangerous. For example, mixing alcohol with cocaine produces cocaethylene, a compound more harmful to the heart than either substance alone. Addressing alcohol and drug abuse is essential for protecting heart health. But what if a seemingly unrelated issue could also lead to heart damage? Number 2, viral infections. Many think viral infections are short-term issues, but some can have lasting effects on heart health. A key concern is myocarditis, an inflammation of the heart muscle often caused by viruses like Coxsackie virus, influenza, and SARS-CoV-2 or COVID-19. These viruses can directly damage heart cells, disrupt the heart's electrical system, and impair its ability to pump blood, leading to heart failure in severe cases. In addition to myocarditis, viral infections can cause pericarditis, inflammation of the heart's lining, which can restrict heart function and potentially lead to heart failure. Some viral infections may also trigger an autoimmune response, where the body's immune system attacks heart tissue, causing further damage and increasing the risk of chronic heart conditions like dilated cardiomyopathy. While most people recover, some may face ongoing heart issues, including heart failure. If you experience chest pain, shortness of breath, fatigue, or irregular heartbeats after a viral infection, seek medical attention immediately. Before we unveil our number 1 cause, let's pause for anticipation. To support you in fighting heart disease more effectively, we're thrilled to offer 2 extraordinary free gifts we've compiled just for you. First up, we're giving away our exclusive ebook, 7 foods that clean arteries and prevent heart attacks. This is no ordinary list. It's a treasure trove of culinary delights that are both mouth-watering and beneficial for maintaining stable blood pressure levels. And lastly, you'll gain access to a breakthrough video, the shocking cause of cardiovascular disease, and what you should do starting today. This innovative approach, the ancient signaling molecule found in our ancestors, offers a potential paradigm shift in how the nectar of gods can help restore it for optimal heart health. It's a piece of knowledge too valuable to miss. To claim these incredible 2 free gifts, simply click on the link in the description below. Now, let's return to our countdown and unveil the number 1 cause that stands as a pillar in the 7 fatal causes of heart failure most people ignore. Number 1. Family history. Genes play a crucial role in heart health. If your family has a history of heart disease, particularly conditions like cardiomyopathy, your risk of developing heart problems is significantly higher. Research shows that individuals with a family history of heart failure have a 20 to 50% greater risk of experiencing heart failure themselves. Cardiomyopathy, a group of diseases affecting the heart muscle, is often inherited and makes it difficult for the heart to pump blood effectively. Genetic mutations responsible for conditions like hypertrophic and dilated cardiomyopathy are commonly passed down through families. Additionally, a family history of other heart conditions, such as coronary artery disease or arrhythmias, can further increase your risk. Inherited conditions like familial hypercholesterolemia, which causes high cholesterol, and a genetic predisposition to hypertension and diabetes, also raise the risk of heart disease and heart failure. If you have a family history of heart disease, it's important to discuss it with a professional. They can assess your risk and suggest preventive measures, including regular screenings and possibly genetic testing, to help maintain heart health and reduce your risk of complications. So there you have it, 7 fatal causes of heart failure most people ignore. Now, we'd love to hear from you. Which of these have you experienced? Do you have any symptoms or causes we didn't mention? If this video has illuminated new possibilities for you or reinforced your current health strategies, please show your support by hitting the like button, subscribing to Combat Heart Disease, and also make sure to hit that notification bell so you get instant notifications whenever we upload new videos. And to those considering showing extra support, the Super Thanks feature is a great way to help us continue providing valuable health insights. Before you go, remember to check out the 2 exclusive free gift links in the description below. Remember, your health is in your hands. Thank you for watching. Stay vigilant, stay informed, and here's to your health.